Okay, for the neurological assessment, we're going to start off assessing the cranial nerves. So the first we would assess is olfactory, which is identifying smell. So if I had something, I would put it under the patient's nose and they would identify what that object was. Cranial nerve 2 is the optic nerve. So I would take the Snellen chart and stand quite a bit away, and I would ask the patient to cover one of their eyes and read off the lowest line that they can from left to right. Go ahead.
FDPLTCEO.
Okay, and then cover the other eye, but read it backwards.
OECTLPDT.
DF. Okay.
DF.
So the patient would have not 20/20 vision. It doesn't say which one it would have on that piece of paper, but so that's identifying the optic nerve, doing the Snellen chart, and then I would assess the cranial nerves 3, 4, and 6, which is the ocular motor nerve, the trochlear nerve, and the abducens. So I would start off doing big H. So just look at my fingers and only move your eyeballs to my fingers, or my finger that's moving. Don't move your head. Okay, very good. And then I would do accommodation, so just follow my fingers. Okay, very good. And then lastly, I would use the pen light to make sure that the pupils are equal, round, reactive to light, and I already did accommodation, so okay. Just look at me straight, making sure that the pupils dilate. Okay, same thing. Okay, so the pupils are equal or reactive to light. So that's assessing 3, 4, and 6, and then I would move on the cranial nerve assessment to the trigeminal and facial. So I would feel the patient's jaw and ask them to clench it. Right? Assessing TMJ, and then open your mouth. And then I would take a cotton swab. I'm just gonna use my pen. Ask the patient to close their eyes, and then can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Feel that?
Mm-hmm. Yes.
Okay, and then I would ask the patient to pop their cheeks and resist my fingers. Okay, and then can you smile for me? There you go, perfect. Already smiling, and then I think that's it with trigeminal and facial. Oh yeah, and then I'm going to resist your eyes, so close them and try not to open them. Okay, very good. And then moving on to vestibulocochlear for sound. I'm going to use a tuning fork here and just ring it, and then let me know if you can hear the sound. Putting it behind the patient's ear. Okay. Let me know when you. Ooh, wow, that was. Ooh, can't hold it with this hand.
Yeah, I can hear it.
Okay, let me know when you stop hearing it. Okay, normally it would take longer for the patient to stop hearing, so I'm just gonna move on. You do it on both sides, just to be efficient with the assessment. I'm gonna keep moving on. With glossopharyngeal, I'm gonna have you swallow. Go ahead. Okay, just feeling the back of the throat, making sure the muscle and the cranial nerves work. And then for assessing the vagus nerve, I would assess the patient's gag reflex with a cotton swab, but I don't have that with me now. And then spinal accessory, go ahead and shrug your shoulders. And then as you shrug your shoulders, move your head side to side. Okay, very good. And then the last cranial nerve assessing is hypoglossal, which is the 12th cranial nerve. Can you say light, tight, dynamite for me?
Light, tight, dynamite.
All right, very good. And that concludes my neuro assessment.